Namaskaram, everyone. A very good morning and welcome to WishwaTalks. My name is Radhika Yashwant. Thank you all for attending today's event on Zoom and to those who are watching on YouTube Live. For those of you who attended a Vishwa Talk before, a warm welcome back. And for our new joiners, here's a bit about Vishwa Talks. Vishwa Talks is a platform to create awareness among people and to protect our social heritage and to let people make their own decisions. Here, we invite experts to discuss and explore diverse opinions, different perspectives, various issues, problems, and their solutions on various fields, including art and culture, healthcare, environment, education, and many more. So far, we have covered over 220 talks, and each webinar is an interactive session with a deeper understanding of the topic at hand. If you miss any part of the session, or if you would like to go through the previous sessions, please visit our website or WishwaTalks YouTube channel for a full library of past WishwaTalks. So today, we are delighted to welcome our speaker, Dr. Pragnya Chigurupati Narra, an experienced consultant oncoplastic surgeon specializing in breast health based in Hyderabad. Dr. Pragnya brings with her rich clinical experience and advanced training from premier institutions in India and the United Kingdom, including Tata Memorial Hospital, Mumbai, Royal Stoke University Hospital, and the University of East Anglia, Norwich. She also holds prestigious MRCs from Edinburgh. Currently, she's practicing at AIG Hospital and Fernandez Hospital in Hyderabad. Dr. Pragnya is deeply committed to compassionate care and empowering women with knowledge and confidence about their breast health. As we dive into today's discussion, I would like to inform the audience that our speaker will be taking the questions from you after the main talk. So please leave your questions in the chat box or use raise hand tool and we will allow you to ask your questions in person. I request everyone to turn on your webcam for interactive session and request to keep the questions concise and short and kindly ask one question at a time so other participants also can interact. Without a further ado, I now invite Dr. Pragna to share her insights into breast health across a women's lifetime. Over to you, ma'am.
Hi, everyone. Good morning, and thank you for the introduction, Radhika. I'm Dr. Pragnya Chigurupati Narra. I'm a consultant oncoplastic breast surgeon at AIG Hospitals. I think the first question is, who is a breast surgeon? Well, breast surgeon is someone who takes care of everything related to breast from head to toe with regards to any non-cancerous diseases, any growth abnormalities, well, of course, the big C cancer, and also any cosmetic issues. Keeping this in mind is what I'm going to be, briefly covering in today's talk. If there's any question, please feel free to ask me. Let me just share my screen. Just give me 1 minute. Yeah. What can you see?
Yes, ma'am. I can see. Yeah.
All right. So again, good morning, everyone. Yeah. Good morning, everyone. So I'm just going to briefly take you through breast health across a woman's lifetime. I'm sure you people really don't think it's a taboo, and I hope it doesn't turn out to, feel like a taboo topic, because that's myth that all of us are trying to bust in terms of trying to make sure that women reach out to doctors as soon as possible. So here's your chance to go and speak to women around as well. So we all know that generally they say that breast lumps, etc., mean cancer. So most of the patients don't end up coming to the clinic out of fear or just the fact that they don't want to be diagnosed. Well, let me just tell you one thing: 9 out of 10 lumps are non-cancerous, but then they can turn cancerous, and that's exactly why you need to be diagnosed the right way. All the other breast symptoms, which I will mention to you later, they are not benign. That is, some people say breast pain or chindi, fine, I'll be okay. But you know what? That can be a subtle sign of a cancerous lesion. If you have any breast symptoms, make sure that you reach out to a doctor and not one of your neighbors who probably just says something out of, experience, because that could be wrong. And also remember that sometimes breast cancers can be asymptomatic, no symptoms. And that's why you should get screening done regularly from the age of 40. And the other point that you should know is that breast cancer, if it's detected early, is completely curable. It's not like the olden era when things cannot be cured and it's the end of life. Do not panic if you have any of the symptoms, and at the same time, do not ignore. The one thing you should know is that according to the Globocon data, breast cancer is the most common type of cancer currently. In India alone, breast cancer amongst both the genders, male and female, is the most common, 11.7%. It's a combination, and death from this is around 6.9%. Earlier, most of the cases used to be postmenopausal, that is around 50s or 60s, but now a large number of cases are between 25 and 40, and this is definitely a disturbing trend. And to scare you a little further, every 4 minutes, one Indian woman is diagnosed with breast cancer, and every 13 minutes, one woman dies. In rural India, the incidence is 1 in 64 women. In urban India, it's 1 in 22 women. Although in the US, the numbers are much higher, probably because of their lifestyle, the food that they eat, etc. 1 in 8 women are diagnosed with breast cancer, but predominantly early. But for us, most of them are present to us in the advanced stage, hence deaths are high. Earlier, cervical cancer used to be the most common cancer, but currently breast cancer has beat every single disease. So common presentations are obviously breast lumps, pain in the breast, any nipple discharge, or screen detected cancers. That is, when you go for your imaging regularly after the age of 40, it might be detected on that. Symptoms in the young. Most of you must be around 30, 40, or 50, and symptoms in the young does not mean that it's not cancer. It can be cancerous, even if it's in the 20s. So reach out to a doctor if you have any symptoms. And remember, symptoms don't just vanish. You have to get them treated. The other symptoms in younger population, breast pain, lumps, breast infections, they can masquerade as just infections, but it could be actually a cancer called inflammatory breast cancer. And nipple discharge. The reason I highlighted a few of these points are because they are the ones who are often misdiagnosed. So throughout a lifespan, the earlier age group around 10, 20, 30, generally there are non-cancerous lumps, but beyond a certain size, all of them have to be dealt with. Around 1 centimeter or more, they have to be dealt with. So please reach out to a breast surgeon. The other issue with not reaching out to a breast surgeon or going to probably gynecologists or general physicians, which is not wrong, is that often breast is an undertreated organ, and hence experience does matter. I'm just not saying this for publicity or anything of that sort. It actually does matter in terms of treatment, diagnosis, and further monitoring. So the risk factors for breast cancer, obviously age, like I mentioned, and females more than male. Family history is only 10% of those cases are attributed to family history. Otherwise, it's late menopause, early commencement of your periods, not having any children, late pregnancy, childbirth about the age of 30, and exogenous hormones. Like sometimes when you take hormone replacement therapies or OCPs beyond 5 years, these are all supposed to be risk factors. The biggest issue with us is lifestyle. Half of us don't work out. We have a very sedentary lifestyle. We eat junk food, alcohol, lesser amount of fruit and vegetables, less amount of exercise. So all this are, they influence your risk in terms of every kind of disease and not only breast cancer. So how do we detect them? In India, unfortunately, we cannot go around sending letters to every woman saying, please examine yourself. A mammogram, that is a scan, that is a breast scan, is ideal about the age of 40. But because of resource constraints, that does not generally happen regularly. So the next best thing is breast self-examination. A woman should examine her own breasts every month, and those who have their cycles going on after their cycle, and in those postmenopausal women at any one given point of the month. So you look and you feel. I'm going to play a short video which will tell you exactly what you're supposed to look for and at what point of the month you're supposed to look for. So you're supposed to examine yourself in these three positions. When you look at the mirror, take off your shirt and understand if there's something abnormal. And then you can feel in the shower or in the bed or anything that you want to, and see if there's something abnormal, something different from the previous month.
Let's get started. Step 1. Stand in front of the mirror and check your breasts for the changes, including change in your breast size or shape, thickening of the skin in the breast or underarm area, swelling, warmth, redness, or darkening of the breasts, dimpling or puckering of the breast skin, an itchy, scaly sore or rash on the nipple, pulling in of your nipple or another part of your breast, or pain in one part of the breast. Step 2. Now raise your hands and look under your breasts for the same changes. Also feel for lumps or hardness in this area. Step 3. Next, check your nipples for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish, or even tinged with blood and should be checked immediately. Step 4. Lie down on a firm surface on your back and using slow circular motions, feel your breasts for any kind of lump. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. Check the inner part of your armpit as well. Always use opposite hands to check the breast. Step 5. Stand up and repeat the same circular motions from step 4 across each breast. Step 6. If you detect anything suspicious in either of these steps, don't panic. Make a note of your findings and schedule an appointment with your doctor immediately. If everything seems okay, you can be at ease. But remember to conduct this examination every month. But do keep in mind that you do it after your periods are over. Those who are not menstruating can do it on an assigned date every month. Remember, cancer is not the end of the world. In most cases, women who are diagnosed with breast cancer survive and lead healthy lives, especially when detected in time. Keep your date with your gynecologist or breast cancer specialist for an annual preventive breast exam. Early detection is the key. Be informed.
So that's how you actually examine yourself. And when you have to go and figure out what's wrong, these are the symptoms that you generally look out for. They can be swelling, they can be lumps, they can be armpit lumps, they can be some issues with the nipple or just the skin, or change in shape or size of the breast. But also be aware that on screening, they can be completely asymptomatic, and you can try, it's your breast radiologist who can figure out if there's something going on. And sometimes the patient might only have breathlessness, cough, lump in the in the stomach, jaundice, bone pains, visual disturbances, headaches. That means that these are quite late stage symptoms. So anything wrong with your breast, please make sure that you reach out to a doctor. And also, when you do reach out to them, most of the cases they say you'll have to just, remove the lump and then find it without any imaging done. That's wrong. You need to get a triple test. If there's one takeaway from today, this is the takeaway, that you need to get examined by the doctor, and then an imaging technique is suggested based on your age, and then a biopsy should be done. Diagnosis is not complete until all these three are done. Please ask questions and do not shy away. This is a mammogram where the breast is between two plates and a shot is taken, and this is how it would appear. At AIG, there's a 3D mammogram available, which is available in very selective places, and women between the ages of 40 and 55 should get 3D mammograms done. The third part of the examination is a biopsy. This used to be a procedure that people used to do in the past, where the few cells were taken for examination, but this is not supposed to be done anymore. This is what should be done, a biopsy. And treatment involves, if you're diagnosed with breast cancer, treatment does not mean the same treatment that your aunt or your relative or someone had in the past, because every single patient treatment has to be individualized. And they can be local regional treatments or systemic treatments, that is surgery, radiation, chemotherapy, hormone targeted, endocrine therapy, or immunotherapy. And it's not only the breast surgeon who's involved, but radiation, medical guys, pathologist, a good breast radiologist, physiotherapist, genetic counselor, nutritionist, and therapists as well. Back in the day, people used to assume that if you get breast cancer, your entire breast has to be removed, but that is not true. Today, with good studies, we know that breasts can be completely conserved. If this is the lump, this was a patient in which a reconstruction was done and it looks absolutely normal. For the women, please make sure that if someone is diagnosed in your family, remember that every woman reacts differently, and give the person some time to digest the news. And that's when all of you as a family or your support system should stand out for the patient. Coping mechanisms, there's nothing really one thing that patients can be told, because it does push them into depression. None of these coping mechanisms are easy, but individually they should be strong and they should try and get through this entire process. Diet and breast cancer, again, a lot of patients ask me what they should be eating. Generally, avoid outside junk food, sugars, oils, alcohol, salty food, excess amount of soya or tofu, and eat a lot of fruit and vegetables, good amount of meat, brown rice, quinoa, etc. It should be a good amount of mix of all of these rather than individual foods. Now, how do you prevent? Unfortunately, there is no vaccination for breast cancer. It might come in the future, but not for now. What you can do is just examine your breast regularly and get screening mammograms from the age of 40. What are the possible strategies for prevention? Breastfeed your children, early pregnancies, avoid long-term use of estrogen hormones, avoid adult weight gain, 5 servings of fruit or vegetables, avoid alcohol, quit smoking, more than 3 hours of physical activity every week. Well, or join the Pink Self Check chain. This is basically an initiative to bring about breast cancer awareness and social responsibility in 3 steps. Log on to the website, click Pink Self Check chain, take the oath to examine your breast every month, and then nominate 3 other women to do so. So, in that way, you also are motivating other women in your family or friends to save their lives. This is a short video of our AIG breast clinic, and the reason I put it up is again because breast health is generally a taboo in this country. And to circumvent that, to make sure that people still end up coming to clinics, we started a one-stop breast clinic where everything happens in the same unit and the patient leaves. So their privacy is to themselves and they're happy with the end results. One-stop breast clinic that AIG has today is that we conceptualized this clinic to be around the fact that any woman can walk into the clinic and they first get assessed clinically by the clinician or the surgeon. And once they get assessed by them, they get advice as to getting a mammogram or an ultrasound, an MRI, etc., based on their age. So once that's done, immediately they go for the imaging in the next room, which could be any of the above mentioned ones. And once the imaging is done, if in case they need a biopsy or an FNAC or whatever that the doctor suggests, that happens in the room right next door. So once all of them are done, which is called the triple assessment, they leave and then they come back to the same clinic where we discuss the results. Every patient or every woman that walks into the clinic gets a detailed lesson on how to examine their own breast. It can be anyone, it can be the attenders, or it can be or anyone who comes for a master health checkup. So that's our bit that we're trying to do for assessment as well. So let's just bust a few myths. Finding a lump in your breast does not mean you have breast cancer, because it could be any non-cancerous lump as well. Men do get breast cancer, which is why they should examine their breasts as well. And if breast cancer does occur in men, it's very, very aggressive and they generally tend to have a poor prognosis. Having a family history of breast cancer does not necessarily mean you will get breast cancer, but you will be under a high risk, so you should be screened regularly. Breast cancer is not a communicable disease, and it does not spread by touching someone. And surgery for breast cancer does not mean that the entire breast will have to be necessarily removed. With good surgical techniques and conservation and radiotherapy, conservation is absolutely possible. Thank you. And if you have any questions, you can always reach out to us on the numbers given below, or you can even ask me the questions now.
Thank you, ma'am. That was very insightful session. You have discussed about symptoms of breast cancer, the statistics and facts uh, of breast cancer, the risk factors, and very important triple examination, and a beautiful video on how to self-examine their breasts, and myths and misconceptions about breast cancer. So before we move on to Q&A, we would like to take 30 seconds for a quick poll. So this will help us to understand you better. So we tailor our future topics according to your understanding. Yeah, the poll is active now. And while you fill out the poll, I would like to express our gratitude to our speaker, Dr. Pragnya.
It feels like you're judging me based on these quizzes.
Just a second.
Hello.
Hi.
Hello. I have
So
got
we
one
have
question, ma'am.
Yes, please ask me.
Shall I ask?
just a second, ma'am.
Okay.
Did you raise your hand?
Oh,
Yeah.
yes, I raised.
Okay. Yeah. So we have Dr. Shashikala who
Kannada.
has raised. Yeah. Please
Yes.
ask you.
Yes, ma'am. Good morning, ma'am.
Yes, good morning.
I am a consultant gynecologist at the semi-urban area. I want to ask you, ma'am, whether from 40 to age of the 40 to 50, we should undergo the mammogram.
Yes.
Whether it is mammosonogram or mammogram only.
Mammogram. And
Mammogram.
generally,
But in such area, in our area, it's not available for all patients. We have to go for district places. So,
yeah, see, that's the issue, unfortunately, that resources
Hmm.
are constrained and infrastructure is not available everywhere.
Yes.
So, I guess if they can actually go to a district and get a mammogram, that's the best thing
Yes.
that you can do. If not, then I guess an ultrasound. But remember that even ultrasounds have to be done by extremely trained breast radiologists because that's where
Yes.
half the mistakes are.
Yes, ma'am. So after menopause, after menopause also you have to go for this thing only, na? Mammogram only.
From the age of 40, everyone should have mammogram.
And then how often it is? Once a year or?
Once a year.
Okay, thank you, ma'am. Thank you.
So we have Shmuel who has raised his hand. So please, you can unmute yourself and ask your question.
You hear me?
Yes, yes.
Yes.
Thank you very much on interesting presentation. And I want to ask you next question. What, according to your opinion, needed to be a role of authorities in protecting on breast health?
Sorry? I didn't
What,
understand.
according to your opinion, you hear me? What,
I can-
according to your opinion, needed to be a role of authorities in protecting on health of breast?
So he is asking, what is the role of authorities in protecting breasts?
Oh, authorities. Okay. Well, it depends on what level of authorities these are, but it is in the hands of the government to establish multiple mammogram centers throughout the country, throughout the country in smaller areas as well, because Dr. Shashikala just asked a very good question with regards to getting a mammogram or an ultrasound. First things first, getting mammograms done everywhere, getting access to them, giving them access. And secondly, also bringing about a lot of awareness amongst all these women, saying that, there is something called breast cancer. There is, because I'll tell you why I'm saying this, because and then letting them know that there is something called breast cancer, what exactly you should understand about it, what is a mammogram, when you should get it done. And this is the basic awareness that these women should be aware of. Because we are running a mammogram bus that goes to rural India and screens all the women for absolutely free. But women still don't come to us because they don't understand what a mammogram is. They don't understand the importance of it. So first of all, awareness, and second, they'll have to bring about they should bring about talks, or people making sure that they instill it in their mind that talking about breast is not a taboo. It's a disease that's killing a lot of people. So it's something that they absolutely should know about. And then getting mammograms sort of rampantly present everywhere, and good breast radiologists. And alongside that, also treatment wise, they should be given subsidies or given better insurances, etc. So I think it's a milieu of things rather than a single thing that the authorities can do.
Yes, thank you very much. And I have an sorry.
Please go ahead,
Sorry.
Shmit.
Yeah. Thank you very much on your answer. And I have another short question. What government and authorities of India do for health of breast, for breast health in India?
Sorry?
So he's asking what are Indian authorities doing to about breast cancer in India? Indian authorities.
Well, they are doing quite a bit. At least the Telangana government does have a few plans in mind, but until they're actually implemented, we never know how plans change. But they are planning on rolling out multiple mammogram buses that go to different parts of the state and screen women. And we also have a few studies going on in terms of easier ways of diagnosis. So there are things that are going on, but until we actually get results, there's nothing that we can talk about.
Thank you.
Yeah, thank you, Shmit. So we have Sahiti who has raised her hand. Ma'am, can you unmute yourself and ask your question? We have given the access.
Hi, ma'am. I'm at 30 years old. I think from last 2 to 3 years, like I have been getting like post ovulation, my breast, I have heavy breast as well. So I do getting breast pain. So I've been to like few doctors and also to an oncologist. They diagnosed me with fibroadenoma, but the pain still keeps coming. And sometimes the nipple part of my breast hurts. I feel like I have been to multiple ultrasounds as well. The reports were quite normal, but whenever it pains, I feel like there might be a discharge or something might be happening. So what can be the cause of it? And also like when I take some foods like more caffeine or some kind of junk, I feel this more often. Like, is there something to worry about?
Sahiti, you're giving your answer yourself, Sahiti. Honestly, you've given the answer yourself. It's basically a lifestyle that matters, and you will be very surprised to see how everything reduces when you have a healthier lifestyle in terms of exercising regularly, cut down caffeine. I'm guilty. I'm here drinking my coffee as well. So, cutting down caffeine is the biggest thing. And eating a lot of fruit and vegetable compared to our general food, getting good amount of sleep. All these are actually underestimated even in terms of breast health. You'll be very surprised to see how all of them help you. So try to modify your lifestyle first, wearing supportive bra, exercising regularly, getting a good amount of sleep, eating well. These are the ones that will actually help you a lot. Having said that, if this is only after your ovulation, before your cycles, this pain, etc., then it's called premenstrual syndrome, which is unfortunately very, very normal. But It's very, very normal, especially that it reduces after that. There's nothing much that we generally do for this except just symptomatic care by giving hot fomentation or, any pain medication and things like that. But otherwise, it's absolutely normal. Fibroadenomas, just make sure that you keep a track of the size. And if it's about 3 centimeters or if it's growing, then that's something that you need to get sorted out.
Oh, ma'am, just one more thing, will this be turned to any kind of cancerous symptoms? Or...
Fibroadenomas as such don't generally turn into cancer, but having said that, there was one case of mine who was around 32 years old or 29, I'm not quite sure. 10 years of having a fibroadenoma lump, it turned into a cancer. Generally, it does not, right? But in this particular patient, unfortunately, it did.
Okay, but when I get changed to healthy lifestyle, so does this go away, the fibroadenoma?
We can have it. No. So once it's beyond a certain size, they generally do not disappear until you reach menopause because it's all hormonal imbalances.
Yeah, I do have some kind of rubbery lumps. Like I can feel them, but because I got tested, I feel that it is kind of safe. But I also think, is there something that is not being getting detected on ultrasound? Do I need a mammo at 30 years?
No. Don't get mammograms at 30. See, that's where, you need to trust your doctor and see if, she's experienced enough to tell you the right
Yeah.
thing to do.
Okay.
Yeah.
Thank you, ma'am.
Good luck.
Thank you, Sahiti. We have the Varsha Deshpande. Ma'am, you can unmute yourself and ask your question. Varsha Deshpande, are you here? Okay, we have Miss MP who has raised their hand.
Yes. I'm the one.
Okay.
I wanted to know, in your experience, self-breast examination can the woman pick up small lumps, and do we train them for it? Because just mammogram and ultrasound both seem to be costly in our rural part of India. What is your experience, madam?
Thank you for the question. Self-breast examination generally does pick up. See, it depends on the breast size as well. If it's a very small size, like, if it's an A cup or a B cup breast, the woman is generally very thin, then even a smaller lump can be detected. But if it's a larger breast, then possibly not. And Indian women as such are large breasted. So sometimes small lumps can get missed, but it can, as and when it's growing, you can feel it to be an abnormality. So, unfortunately, self-breast examination, like I said, is not 100% false negative, right? I mean, true negative. It's not 100% true negative. It's something that is a bridge between getting a mammogram and an ultrasound and finding the cancer.
Okay. Yes, at least somebody will come to the doctor and take her opinion. Yes.
Yeah.
Thank you. It was a very informative lecture.
Thank you.
Very inspiring too.
Thank you.
Thank you, madam.
Thank you. So we have Nadia who has raised her hand. Please unmute yourself and ask your question.
Actually, it's a little. Can you hear me?
Yeah.
Actually, it's a little difficult for me to say, but I have been diagnosed with breast cancer, and my hormonal therapy shows ER positive when even PR is positive, and I am not sure what is going to be my treatment. Can you give me any, because it was a malignant mass, and so I would like to know what kind of treatment is the best treatment for this breast cancer.
First of all, I'm really sorry for your diagnosis. So to answer your questions, ERPR positive, HER2 negative, right? Is that what you said?
Yeah.
Yeah.
So it's two, you say. That is what I have still not done my PET scan, which I'll be doing very shortly in a day or two. So
And HER2 is negative, is that what you said?
HER2 unresolved it is.
Unresolved. So you need to get a FISH test for that. Okay.
Okay.
So there are a few things. Am I speaking to Miss Nadia?
Yes, yes, yes.
Okay, so there are few things right there. We can never say that this one particular modality of treatment works for one patient, right? So you said rightfully so that your hormone therapy, ERPR is positive and HER2 is unresolved, which means that you need to get a FISH test to understand if you're actually positive there or negative, right?
Okay.
And because HER2 being positive or negative will matter in treatment completely. It'll guide your treatment completely. Okay. And secondly, the PET scan. PET scan will accurately stage your disease. And that's what a PET scan is done for. Now, if you say, and I don't know the clinical stage of your disease right now, the size of the lump, if there are any nodes that are positive or not, all these factors also matter when I guide a person to go ahead and get treatment. So if it's very early stage and if it's
There are few nodes which have been affected and some 3.6 or something centimeters. Tumor size is 3.6 or something centimeters. And also they are not sure about the lymph nodes. That's what.
well, the PET scan should give you better idea. Where are you based out of?
Chennai.
Chennai. Okay. If you're going to take a treatment in Chennai, you can always reach out to me offline. I'll suggest good places to you where
Okay.
you know what they're talking about.
Oh,
Right?
thank you. Thank you very much.
Sure. So basically, see if your nodes are positive or negative, it completely matters on what kind of treatment you're taking. And the stage of your disease also matters. Stage
Yeah.
1, 2, 3 can be treated with something. Stage 4, you don't need surgery. Honestly, there are a lot of things that go into this, and getting the accurate information is important before I suggest any kind of treatment for you.
Okay. Okay. Thank you very much. Thank you.
Sure.
I'm relieved somewhat to talk to someone. Thank you very much.
Good luck. Yeah.
Thank you, Nadia.
Mm.
So we have MP who has raised their hand. Can you unmute yourself?
Can you hear me, ma'am?
Yes, yes.
Yeah. Ma'am, I have a question. I have heard about something on the lines of thermal mammography, which uses heat to detect breast cancer. And I have also heard that it is less painful than the traditional mammography. Is it true? And if it is true, how effective is it?
It's less painful because there's nothing that they actually do in that except just point something at the breast. I would never get that done because it gives you a lot of false positives, increases the anxiety in the patient, and also does not give you the answers that we require for treatment.
So basically, it is ineffective. There is no point in getting it. Oh, okay. 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 Thank you, ma'am. Thank you so much.
Thank you. We have a guest who has raised her hand. Ma'am, can you unmute yourself and ask your question?
Yes,
Yeah.
Savita here. Hello, Dr. Pragnya. My question is, what are the risk factors that can point out to risk factors by doing any blood tests? What are the blood tests that can be done to know the risk factors?
I lost still for 2 minutes. Could you repeat your question?
What are the blood tests that tell us about the risk factors that there is an inclination towards the getting the
Unless you have a strong family history, and any of those patients who are affected with cancers are positive for any genes, right? You don't need to necessarily get any other test because there are no blood tests that will lead you towards a diagnosis of breast cancer. There are certain studies that are trying to come up with something called ctDNA, that's circulating tumor DNA with liquid biopsies, but nothing is conclusive right now.
What about the CA-125 and other multiple things they tell them?
CA-125 is for ovarian cancers and not for breast cancers. So ovarian cancers, it sort of gives ovaries, unfortunately, are not something that can be screened very easily, which is why lots of them are incidental findings on surgeries or they come to us in stage 3 or 4. because it's not easy to screen. Ovarian cancers, you'd use CA-125, but not for breast.
Okay, thank you. Any diet factors, ma'am, that help us even it is general for general population?
Unfortunately, most of our food is adulterated. Unless you can have your own organic, farm and getting your milk, eggs, vegetables, fruit, etc. from there. I don't know what is adulterated, what is not, and everyone is at a risk. All of us are at a risk, honestly, and that really scares me half the times, but there's nothing else that we can do.
Okay, thank you.
Yeah, thank you, Ms. Savita.
Thank you so much.
So there is a question from Ms. Sahiti. Is the nipple pain at some days something to worry about? Also, can the breast size increase with age post 25?
Yeah, if you generally gain weight, it can increase in size. Or when you get pregnant, or when a person becomes sexually active, or when you start breastfeeding or things like that, yes, it can increase in size. Nipple pain is normal. Sometimes it's also a part of this premenstrual syndrome. So you just have to understand how this is happening and understand the flow of events.
So there's a question from Surya Prabha. I have some query while pressing tits getting oily substance, like someone or two drops, not daily, rare, very rare. That too only pressing. What's the reason? Maybe menstrual times or hormonal change.
Yes, that's your answer. Sometimes just physiological. And when you when you examine yourself and you squeeze the nipple area on your breasts, yes, that can happen sometimes. And that's normal and physiological.
Okay. So this is a question. Are fibrocytic lesions in breast a normal?
Yes, they are.
So I think we have covered all the questions, ma'am. It was a very wonderful session. We have learned something new.
I just said the same question, Miss Pinky. Can you share some timelines for the examination? Every woman has to be examined regularly after the age of 40. And those are the family history even before the age of 40. And everyone should get regular 3D mammograms done from 40 to 55 every year.
So this question, Shishma is asking if you could address surgical menopause.
What about surgical menopause?
Sushma, can you come online and ask your question? Okay, this is another question. What are the possible causes of itching in one breast?
Dry skin. See, sometimes there's eczema, there's dry skin, etc., that can appear on one breast as well. But you have to make sure that there's nothing, it's not long-standing, it's not any just skin changes like redness or, accumulation of sweat or any underlying lump, etc., or uncontrolled diabetes. All these causes can also cause itching. Root canal. I'm not aware of anything of that sort.
Yeah, I think we are good with the questions, ma'am. Yeah, Shushma is asking, does surgical menopause raise risks?
The indication for surgical menopause is important because only then it will tell me why what are the other risk factors that you have. Having said that, once you go into menopause, I assume you're saying that you removed your ovaries for some reason. Well, in that particular case, see, any woman, complete estrogen does not get stopped, because as a woman grows, we do end up getting fatter, honestly, and I'm being very blunt because our ovaries don't protect us enough. And as we get a lot of this peripheral fat, that fat can get converted into estrogen and attack our breasts. So you should be very careful with regards to postmenopausal weight gain.
Does early menopause has anything to do with increased risk for breast cancer?
Not really. It's the entire age group period when you're exposed to estrogen, increase in estrogen, that is from when you start your periods till your end of your period. So early menopause, if anything, is protective.
Hello, ma'am.
Yeah, hi.
Shall I
Hi, Vapa.
ask?
Yeah,
Uh,
sure.
I'm having few more questions. Madam, how does it, what's the amount of percentage in genetics cases, hereditary
10%.
cases? 10%.
Yeah.
And in such cases, males also should undergo the testing. If mother is having CA breast, auntie is having CA breast, so in male also should be this examination has to be done or mammogram has to be done in the male also.
Yes.
Yes.
If
And
they're
one more
positive
question.
for that gene.
Okay. BRCA is useful or no, madam? Nowadays they are doing BRCA in Bangalore and all.
Generally, we are getting comprehensive genetic panels right now. So
Mhm.
yes, BRCA is important, but there are other genes also that can cause breast cancer.
Okay. And madam, exercise, how it helps in exercise? Sedentary lifestyle is there, but how it helps to reduce
Exercise
the
regularizes hormones and it does not cause an overkill of any estrogen or etc., which is the main causative factor of breast cancer. And if you regularize hormones, all these symptoms also reduce, generally breast pain and cystic and benign cancer, benign tumors, etc.
Okay. And nowadays, madam, early menopause is there. We are seeing the females at 10 year only they start the menarche. In such cases, you have said that high risk for this CA breast, no, madam. Just now you said, huh?
Yeah.
So we can't change it, na. That they should undergo the exercise and all things.
Why is she having early menarche? Because we are giving her adulterated food. We are
Yes,
giving her, we're pumping her with estrogen from a much earlier age.
fast food.
We have to deal with that first, and then
Okay.
exercise, etc., will not reduce if there are other factors being fed to her.
Okay, okay. And madam, we'll see that so many cases that just yours explained that itching over the nipple, and in ANC cases also sometimes we'll see the itching and all this with this thing. It's due to allergy or due to any this thing. But in CA breast also it is commonest in symptom is there or what, madam?
Itching?
Uh,
Yeah, itching
redness,
can
itching. It's
happen.
not.
It can happen. Inflammatory breast cancer.
Okay, madam. One more. I'm asking few many questions. How coffee is harmful because I also like coffee, drinking coffee. Just now you said na
Caffeine,
caffeine.
again, all of them lead to some sort of hormonal abnormalities in your system,
Mm-hmm.
right? And that's when, when there's an abnormal jumping up and down of hormones, that's when all these issues.
Okay, thank you, ma'am. Very nicely elaborated. That AIG is
Thank you.
Asian Institute of Gastro only, na, madam? High-tech city.
Sorry?
You all said
Yes,
AIG
yes.
breast center. That Asian Institute of
Yes.
Yes.
Gastroenterology, na? AIG is
Yeah,
Asian
but then
Institute of Gastroenterology. It's high-tech city, na? Okay,
yes,
ma'am.
Yes,
this
ma'am.
is the
Yes.
hospital.
Okay, thank you, thank you, thank you, ma'am.
Thank you.
Thank you.
So we have a question. Does it cause any risk if non-cancer lump is not removed? As doctor said, it is very small to be removed.
Not really, as long as you know it's not a cancerous lump.
Okay.
But it also depends on what kind of a lump it is. There are many non-cancerous lumps, which few of them can turn into cancer, few of them don't turn into cancer. So an appropriate diagnosis is very important.
So question from Pinky, what's the age of menopause in Indian women? Is it to do with when you have started the menstruation or age is a factor only?
It's very individualized and every patient is different. Age of menopause, generally, average age is around 52.
So Miss Nadia wants to ask a question.
Yeah. See, my family doesn't have any history of this cancer. But the point is that, I was on birth control pills, contraceptive pills for a long time. Has this caused it, or because I
We
had a
can never tell. Before you complete your question, I'll tell you. We can never tell.
Okay. I had a
Yeah.
Sebacus
OCPs is a very
long back. I mean, it was there from 2007. Has that
what?
caused it? Sebacus cyst.
No, sebaceous cyst doesn't matter.
Okay.
Yeah, thank you, Nadia.
Thank
So
you so much.
Karunya is asking, I have nipple crack on both nipples and also burning sensation on one side. Ultrasound is normal. I go to dermatologist for eczema treatment, but still it doesn't go away completely. Should I go for further test? It's been a year.
No, it's the both sides. No.
Can fibroadenoma of size 2 centimeters turn into cancer?
Generally not, if you're sure it's a fibroadenoma. But like I said, one patient did surprise me she was treated outside for almost 10 years, saying that there's nothing to worry. She just left it, but then it turned out into a cancer. Yes, it's not about circulation, it gives good support. Yes, hormone replacement therapy leads to breast cancer. I mean, there is a continued, consumption of estrogen does cause breast cancer.
There's a question from Sahiti. I have been to OITI medications for fertility and they suggested estrogen medication for 5 days. Are they safe? How long can we use them? I have used them for 1 month and haven't experienced any breast tenderness, which I usually get every month. Any side effects? Please answer.
If it's fertility, if it's just a fertility, IVF, etc., generally these short courses, we don't have evidence saying that they cause breast cancer. But prolonged usage of it, yes, around 1 year, more than that, yes, you can get affected with it.
Does HRT lead to breast cancer?
I just answered that question. Oh, wait, not wearing a bra helpful. What?
Does wearing bra is helpful? It makes breast circulation better.
It's not about circulation better, it just gives good amount of support. So the patient is more comfortable and experiences lesser breast pain, etc.
Yeah, I think we are good. Good, ma'am. So thank you for your time. You have taken your time from your busy schedule for our audience. It was lovely talking to you and our audience.
Thank you.
Yeah.
Thank you so much.
Thank you, ma'am. So lastly, please take a moment to subscribe to WishwaTalks to get alerts on our new talks, exclusive events, and access to Wishwa community. So follow us on Instagram, Facebook, YouTube, or LinkedIn for future updates. See you all in next WishwaTalk.